Welcome to Meditech Matters. Hi, welcome to episode 5.
Today, we wanted to talk about diabetes. According to recent data, the risk of diabetes is increasing significantly in 2024. Studies have showed that there's been a nearly 20% rise in type 2 diabetes over the past decade. And there was a 2010 CDC report which showed 1 in 3 American adults could have diabetes by 2050. The report also projected that the number of new diabetes cases would increase from 8 per 1,000 people in 2008 to 15 per 1,000 in 2050, which is nearly doubling.
Yeah, that's a great point. It's currently affecting over 500 million people worldwide, and that's about 1 in every 10 adults.
Yeah, but in the US specifically, it affects 11.6% of the US population, or around 38.4 million people. In terms of type of diabetes, about 90 to 95% have type 2 diabetes, while only 5 to 10% have type 1 diabetes.
Yeah, I mean, it's a big problem in the U.S. I mean, we already know that the U.S. is like an obesity issue, which is also like diabetes causes obesity. And this relates to the unfortunate fact that more than 60% of all non-traumatic amputations of lower limbs occur for people with diabetes because they can't like bear their weight and it affects their joints. In the U.S., like a limb is amputated due to diabetes every 3 minutes and 30 seconds, which is just an astonishing fact.
Yeah, I agree. That is a pretty astonishing fact. But additionally, because these amputations and all the other various diabetes treatments, the medical costs for people with diabetes are more than twice as high for people without diabetes. And specifically in 2022, the cost of total diagnosed diabetes in the U.S. was a colossal $412.9 billion.
So when you're confounding the cost with like the amputation cost as well, so the cost for the actual treatments and then like the amputations if it's required, and just all the other medical costs that, like we said, is really expensive, and the toll on the body, it's really bad, not just while you're living, but the death rate is actually also like significant, as it's the 8th leading cause of death in the U.S. As per 2021.
Yeah, and unfortunately, diabetes is starting to affect younger populations. So, in terms of pre-diabetes, which is obviously the precursor to diabetes, 97.6 million people aged 18 years or older already have pre-diabetes. And this is 38.0% of the total U.S. population. This shows that it's affecting younger populations, and the main reason for that is because of unhealthy diets. So in the US, we know that we eat loads of heavily processed foods and drinks packed with sugar. They become staples in many households across the US, which is certainly contributing to this rise in prediabetes and diabetes.
So before we go in to discuss the types of technologies that are being developed, you may be wondering, like, what is diabetes? So diabetes is a chronic disease, and it occurs when the body can't produce or use insulin properly. And this is what results in high blood sugar levels, which also relates to obesity and other like blood pressure risks. So you may have heard us mention like type 1 and type 2 diabetes. So type 1 diabetes is a genetic type of diabetes. It's inherited. And it's when like the body's immune system destroys the cells that produce insulin. And this is why the body can't produce insulin properly, because these cells are being killed. So it's an autoimmune attack. Type 2 is typically developed through lifestyle habits, like poor diets, exercise, and this is the more common one, as we discussed, 90 to 95%, especially in the US. So this is where the body doesn't produce enough insulin, or the body's cells don't respond well to insulin. So it's not the insulin cells being destroyed, but it's a lack of being able to produce enough. And there's also, this is a more like unknown type of diabetes to the general public. It's called gestational diabetes, which is actually just high blood sugar that develops during pregnancy in a woman who doesn't already have diabetes, but that's not necessarily relevant to the technologies we're going to discuss or diabetes as a whole.
Yeah, and like Soha mentioned, the cause of diabetes is not being able to produce insulin. So the typical way to remedy this is called insulin therapy, and when the body can't produce enough insulin, and this occurs in type 1 diabetes or advanced type 2 diabetes. People with diabetes will typically just inject themselves with insulin to remedy this. People with diabetes also have to monitor their blood sugar to make sure it isn't, or make sure it's within target ranges, and are typically advised to change their lifestyle for people with type 2 diabetes to combat the lack of insulin in their body. Now that you guys know what diabetes is and who it affects, and the fact that it's such a prevalent disease, we're gonna move on to some newer therapies and technologies that are being developed. The first one it's pretty simple. It's just oral insulin. So insulin, like I said before, is typically injected into your body. Oral insulin is different because it's just a pill that you take, which controls your insulin levels in your body. This has countless benefits, which include fewer side effects, a more controlled release of insulin rather than just pushing a bunch of insulin into your body with a needle. There's no need to refrigerate, and it also reduces pain. Obviously, you don't have to poke a needle into your body every time you need insulin. So how oral insulin works is the pill is the insulin is encapsulated with the pill that protects it from stomach acid. Now, this is important because the insulin needs to be released in the liver and not just disintegrated in stomach acid. When it's released into the liver, it can remove sugar from the blood and control blood sugar levels. The first oral insulin pill that was approved was approved in 2019, and it's called Rybelsus. And it's for type 2 diabetes. Obviously, it doesn't require injections, and it works by improving blood sugar, by slowing digestion, and preventing the liver from producing too much sugar. It also helps the pancreas produce more insulin.
Yeah, and I mean, you may be thinking like, oh, this isn't an extremely groundbreaking like technology. It's not, but it just makes it much more efficient and much more simple. I mean, would you rather take a pill or take an injection? And it's just oral insulin in general is just much more efficient. Like a technology that we are going to discuss though that's a little bit more groundbreaking is another injectionable medication. It's called tirzepatide, commonly known as Mounjaro, and it's used to treat type 2 diabetes, and like with oral insulin and all the other ones, these treatments also have to be administered with diet and exercise. It's not like you can just take the medications and not live a healthy lifestyle. Anyways, tirzepatide is one of the few FDA-approved dual glucose-dependent polypeptide and glucagon-like peptide 1 receptor agonist. So it can help with weight loss and lower blood sugar levels. It's pretty recent. It came out on May 13th, 2022, and it's by the company Eli Lilly and Company, and it's an injection form, like we said. So it is like in terms of being administered, it is like the current insulin injections, but it's a little bit more groundbreaking because it uses a different method. So the good thing about tirzepatide is that the side effects are relatively less frequent, and they don't affect your lifestyle as much. So the more common side effects is just stomach pain, which isn't like a grave effect. The less common ones are difficulty in breathing or swallowing, a fast heartbeat, gaseous stomach pain, which notice how stomach pain is separated from gaseous stomach pain, meaning that the more common stomach pain side effect is likely not as severe. You also have heartburn, recurrent fever, skin itching, rash or redness, stomach fullness, swelling of the face, throat, or tongue, vomiting, and yellow eyes or skin. So these less common side effects do seem concerning, but the more common ones aren't, which is a really good sign in terms of it being, it won't be a deterrent from everyone's daily lifestyle that's taking this medication.
Yeah, I mean, Soham introduced a really great new therapy that has a lot of hope for people with type 2 diabetes in the future. But now that we've talked about remedies or therapies for people with type 2 diabetes, we're going to move on to one that's used to treat primarily or only people with type 1 diabetes. Lantidra is a drug, and how it works is it infuses pancreatic islet cells that are harvested from deceased donors. And these cells are infused into the patient's liver, which allows the transplanted cells to reduce insulin and regulate blood sugar levels. It potentially can eliminate the need for external insulin injections because it, like I said, replaces the insulin-producing cells within the patient's pancreas. And Lantindra has been FDA approved very recently, actually last year, in June of 2023. It was the first approved cellular therapy for type 1 diabetes. Now, the downsides are the risk from the infusion, the actual infusion, can be pretty large. So it can cause damage to the liver and even like severe bleeding. It also there's also always the risk of viruses from the previous donor. And then the infusion can also be stopped if the procedure increases pressure in the blood vessels of your liver. With that being said, Lantindra does have a very bright and hopeful future because in clinical trials, 70% of patients no longer required insulin, like external insulin, 1 year after receiving Lantindra. This is a pretty high success rate, and as Lantindra gets more and more refined, we hope it can impact the lives of people with diabetes.
So Cruz mentioned how Lantidra is used to treat type 1 diabetes, and as he said, because it's like made of these pancreatic cells and it helps like produce more insulin, it combats the fact that type 1 diabetes was the one that was destroying these cells, so it's replacing them to make sure that there's enough insulin produced, which is different than the ones for type 2, where it's like altering the cells to produce more insulin, but this is where they're like replacing the ones that are being destroyed to make sure that there's enough cells that can produce insulin. So another similar oral medication, which is similar to the oral insulin that we talked about earlier, is an SGLT2 inhibitor. So these oral medications target the kidneys. So they help the kidneys get rid of glucose and sodium through urine. So they are preventing the kidneys from reabsorbing glucose, which is extremely important because this removes the excess sugar through urine. So when you pee, it's releasing all this excess sugar because your kidneys are not reabsorbing it. So that's extremely important. And it's a relatively like efficient and easy process compared to some of the other bodily functions that these remedies try and instill, because your kidneys simply getting rid of the glucose through urine is a pretty efficient pathway. And this also ends up helping with weight loss, lower blood sugar, and improved blood glucose levels because, like we said, it prevents reabsorbing glucose.
Yeah, and among all the new therapies that we've been talking about, a very, very new one is the role of AI. So artificial intelligence has been used to analyze blood sugar patterns and predict spikes and drops in someone's blood sugar. And then the AI can even recommend personalized treatment plans. Large tech companies like Google and Apple are diving into this space, and it really shows the potential of AI. Additionally, a lot of scientists are developing new smart wearables, right, that can detect early signs of diabetes or insulin resistance. And then these new devices can hopefully combat the rising rate of diabetes in the US and around the world. Though on the other hand, all these new technologies, they are super interesting, super exciting, but they all come with a very hefty price tag. Especially if these things are just recently FDA approved or not even FDA approved, people with diabetes can have a hard time getting in their insurance to cover these new treatments. This really makes the problem worse because people of lower socioeconomic status are more likely to have diabetes because of factors like the fact that they can't afford healthy foods or the fact that they can't afford preventable measures like, getting regular checkups. So this really advantages wealthy people because number one, they have a lower chance of getting diabetes in the first place, and number two, even if they do have it, they have far more access to new therapies that are coming out.
So I would like to talk about a personal experience maybe to wrap things up. So my neighbor has diabetes, and one day when I was coming home from school a couple years ago, I see him being wheeled out on a stretcher with the ambulance right there, and I was just super concerned because it's my neighbor that I would see all the time, talk to all the time. And I knew that he had diabetes, but I was unsure, did diabetes cause this attack or what had happened? But diabetes had caused his blood sugar to spike dramatically, and he'd had a heart attack. Thankfully, he survived. But it's also one of those things where if you looked at him, he doesn't have the physical appearance, maybe the obesity that you would associate with diabetes. You wouldn't know. And that's why diabetes is so important to talk about, because it's just becoming increasingly more common, and anyone can develop it, whether it's genetic or whether you're going to develop it in your life. And it's also important to note that living a completely healthy lifestyle obviously is like the best you can do, but you can live a moderately healthy lifestyle and be unfortunate and still develop diabetes. It's not like it's 100% that like you won't get it if you're doing what you're supposed to be doing. So with that being said, with this experience I had with my neighbor, and it was a little bit, it was really sad for me to see the state that he was in. We really want these technologies that we discussed to become more useful, because not only will it help people now, but it'll become extremely important in the future as the risk of diabetes is increasing for our generation.
Yeah, with that being said, thank you guys for listening, and we hope you guys tune in to the next episode of Meditech Matters.